All right, so this, of course, is the big story that we are tracking on Fine Print tonight. It's been over 2.5 years since the first outbreak of the COVID-19 infection, and the world is still grappling with the new variants of the COVID-19 infection that are still emerging. Now, there are small outbreaks that have been reported in different parts of the world. Most countries, however, have now learned to live with the COVID virus. But now there is another cause of serious concern, and this has got to do with the monkeypox virus. The World Health Organization has said that the rapidly spreading monkeypox infections represent a global health emergency. The WHO label of a public health emergency of international concern is designed to sound an immediate alarm. And a coordinated international response is needed, and this could, of course, unlock funding and global efforts to collaborate on sharing vaccines and treatments. The WHO is also issuing recommendations which it hopes will spur countries to take action to stop transmission of the virus and also to protect those who are most at risk.
I think this is a call to action. This is not the first. The DG brought the committee together. It was an alert to the world. The WHO has been highly active on this since day one. This is not the beginning of the response. This is an intensification of his calls to the world that we must act now and we must act together, as we have been acting up to now. But like every effort in human human science and human health, there are times when you must accelerate that effort, and I think today's call is for an acceleration of our collective efforts to bring this disease under control.
Now, according to the WHO, over 16,000 cases have been reported across 75 different countries. There have been at least 5 deaths that have been linked to these viral infections. At present, there are only 2 other such health emergencies that have been declared. One was, of course, for the COVID-19 pandemic, and another for the eradication of polio. The cases of monkeypox are being investigated in European nations, including in the United Kingdom, as well as in the United States, Canada and Australia. In the United Kingdom, there have been over 2,000 confirmed cases of infections. Now, these are said to be usually mild, and the risk to the general population is said to be fairly low. But the British government has purchased stocks of smallpox vaccines to guard against monkeypox. Now, more than 100,000 additional vaccine doses have also been purchased, taking the total to nearly about 40,000 doses that have been bought to try and stamp out this infection. Meanwhile, India's capital, New Delhi, has also reported the very first case of monkeypox. A 31-year-old patient with no history of international travel is said to be suffering with this infection. Now, this is India's 4th monkeypox infection. All 3 other cases had been reported from the southern Indian state of Kerala. Monkeypox is caused by the monkeypox virus, a member of the same family of viruses such as smallpox, although it is said to be way less severe, and experts also say the chances of infection are also fairly low. The 2 main strains of the virus, the West African and the Central African, are known to exist, and it is the milder one from West Africa which is now circulating in other regions, especially in Europe and North America. The symptoms include fever, headaches, swelling, back pain, aching muscles, swollen lymph nodes, etc. And once the fever breaks, a rash can also develop, often beginning on the face and also on the genitals. And these rashes can, of course, cover a large part of the body, including palms and also the soles of the feet. The rashes can be very itchy and very painful, and they go through different stages before eventually forming a scab. Now, the infection usually lasts anywhere from 14 to 21 days. Monkeypox can spread when someone is in close contact with an infected person. The virus can enter the body through broken skin, the respiratory tract, or through eyes, nose, or mouth. It has not been previously described as a sexually transmitted infection, but it can be passed on with close bodily contact. It can also spread by contact with an infected animal, such as monkeys, rats and squirrels, or by virus-contaminated objects such as bed sheets and other pieces of clothing in which an infected person has come in contact. Now, experts say that declaring monkeypox outbreak to be a global emergency is a significant act. It is a rallying cry for countries to take the virus very seriously and not to follow a callous approach. Right, now to help us understand as to what this infection is all about and how concerned should we be as individuals and what are the precautions that we must exercise to try and ensure that we don't end up without infection, we're being joined by Professor Amos Panat, who is joining us from the Hebrew University of Jerusalem. The Professor, this of course is the latest outbreak of infection. A lot of the cases have been reported in Europe and North America. And now the WHO has also sounded the alarm. How concerned should we be?
Yeah, well, at this point, we should be careful not to get into panic, because we know this virus for many years, and we have a pretty good vaccine against the virus, which is actually developed against the smallpox. The smallpox was a virus which used to circulate in Europe in the Middle Ages and kill millions and millions of people. But luckily, the monkeypox is not as pathogenic, is not as dangerous as the smallpox. It's a relative mild version of the smallpox that was circulating many years ago in Europe. Right. Nonetheless, the virus can be transmitted from human to human, not only from animal to human, but transmission from human to human is not easy. Most of the cases are sexually transmitted virus at this point, mostly in a homosexual relationship. Mm-hmm. And if the virus do not evolve to transmit by other means, and we know the viruses can evolve very rapidly. Absolutely. And start different modes of transmission. So we should be careful, you know, and especially conduct a sexual relationship in a safe way, like people are doing for the AIDS virus, and we will follow it along the time. We see if it's evolved to other forms. Mm-hmm. If not, then with a vaccine and with a drug available, there is also a drug available now, we can handle this pandemic. But we have to be watchful.
Right, that's absolutely crucial that we've got to be watchful. Now, this infection is not being described as a sexually transmitted one. Now, there are reports that a person can, in fact, get this virus by coming in contact with a fabric or a pieces of cloth or a bed sheet, etc., that has come in contact with a rash that is developed on the person who has got monkeypox. So how careful have we got to be? And also considering that this is the manner in which this virus spreads. It's not an air-spreading disease, like what happens with COVID-19 infection. But still, we've got almost about 16,000 cases that have been reported worldwide. I'm pretty sure the actual number of cases could be even more. So why is it that this virus has not been arrested so far?
Because the virus is not easily transmitted. It's not like the COVID-19, which very easily transmitted. You have to be in close contact with an infected person. Mm-hmm. We know that most of the 16,000 cases now, infection is due to a homosexual relationship. Right. There are cases that are related to very close proximity with the skin of diseased person, because there is the pox, the eruption of the sores on the skin can also cause infection of a nearby person, but in close contact. So once a person is infected, he has to be isolated and treated carefully, by medical staff who are protected, like they are protected now against COVID-19. So right. Pretty much the same type of protection, masks, special clothing will be sufficient to avoid infection of the medical staff.
All right, we'll have to leave it there. Thank you very much indeed, Professor Panat, for joining us from Jerusalem and getting us all those insights. This, of course, is a serious infection that's been spreading, but we can, of course, take some of these precautions to stay safe from it. WION is now available in your country. Download the app now and get all the news on the move.